With that, I will now introduce our wonderful speaker today. Here we have Dr. Patricia Malerich. She is an assistant professor, clinical dermatologist, and director of wellness of the Department of Dermatology. She's an Ohio State College of Medicine alumnus and is in her 17th year of dermatology practice. So please join me in welcoming Dr. Malerich.
Okay. Let me do this one more time. I'm going to share my screen here. Okay. Am I sharing the correct screen?
Yes, looks perfect.
Okay. Well, welcome everyone. I am Patty Malerich, and thank you so much for sharing your lunch with me to talk about the largest and greatest organ in our body. We are going to talk about the amazing organ that is the skin, and it is the biggest at 16 to 21 square feet. We have 11 miles of blood vessels running through our skin. It can be 15% of our ideal body weight. And the amazing part about the skin is that it loves you. It provides you immunity, protection, insulation, temperature regulation, sensation, and wound healing. And the most amazing other thing is that it's a working factory. We're producing hair and nails and vitamin D. It regenerates, which is also amazing. We get rid of 30,000 old skin cells every day. And the skin you see today in a month is going to be completely made of new cells. And also microbiome. We have a diverse microenvironment for microbes. It's like a tiny ecosystem, kind of like Horton Hears a Who, sort of. Yes, there's bacteria, yeast. There are little mites, so don't be grossed out. Those are little Demodex mites. They live on us every day in their own little in their own little world. So how can we return the love that our skin gives us? Today we're going to talk about how to protect our skin, cleanse it, moisturize, and repair. So I have added some fun trivia facts for you. So I know you can't answer, but I want you to sort of answer to yourself and see how many of these we can get right. So this gentleman worked for 35 years in the same job. So by looking at his skin, was he a delivery driver or a farmer? And so if you look, you can see he's got pretty asymmetric skin findings on one side. So if you figured it out, you were correct if you said delivery driver. So he had unopposed UV radiation coming into the left side as the driver. And so that caused a lot of photoaging, which we're going to talk about. So when we talk about protect, let's talk about what we're actually protecting against. So what are the insults that our skin is sort of facing? And the biggest one is sort of sunlight. And this is our UV wavelength radiation. So we have UVA, UVB, and UVC. And luckily, UVC is pretty much blocked by the ozone. And then we have UVB and UVA. And I'm going to teach you this now, and it's going to come back later. But UVB is the burner. So UVB is what gives us our sunburns. UVA is our photoager. So B for burn, A for age. The thing about UVA is also responsible for delayed tanning. So we use this UVA bulbs in our tanning parlors. And the UVA is also what penetrates our window glass, especially the side windows of our car. Now, our front windshield is double pane, so it does get a lot of blockage, but UVA is going to be the one that comes in our side windows. So why do we care? So I always try and teach the residents and patients something scientific so you can make sense in your mind. So we know that UV radiation, you have incoming photons, and they're going to hit our DNA, and our DNA form these thymine dimers. And then we have a repair molecule, kind of like a repair truck that comes along and refix our DNA. But as cumulative damage happens, these dimers are going to cause DNA damage that eventually is going to create an immortal cell line, or as we know as cancer. In any organ, any system, that immortal cell line that just does not behave to its gap stops is going to be cancer. So the more UV radiation that's hitting our DNA, the more likely we are to develop skin cancer. So I'm going to go quickly through this. I know you're eating lunch, so I try to keep the most gruesome pictures out of here, but our most prevalent of all cancers is skin cancer. So US, we have risk of 1 in 3 of us is going to get some sort of skin cancer. 1 million Americans develop a skin cancer every year. It's increasing. for various reasons, but 80% of these are going to be basal cells, 16 are be squamous cells, 4% of it could be melanomas. And I didn't talk about Merkel cells like Jimmy Buffett had, but we're going to talk about the three main ones that we see regularly. So I'll try not to bore you, but I'm going to show you some basal cells. So you can see this radiation coming down, hitting the skin. And basal cells are going to be the most common type of skin cancer, okay? They're going to grow slowly. They're curable when they're caught early. But the problem with basal cells, and some people say, well, if it's not going to kill me, why would you treat this? And the problem is it can become locally invasive. They can be deep into the tissue, destroy the skin, and they can go all the way into the bone. It can metastasize, but it's pretty rare. So I have some pictures here. These are going to appear mostly like this gentleman on the left, like a red spot that just won't heal, a spot that spontaneously bleeds, I need to hear about, a shiny pink spot that you're like, huh, this isn't like a normal mole. They can ooze, crust, itch, and bleed. More developed, well, there's two of them. More developed ones, it's going to become a little more apparent. This is what we call a rodent ulcer because this is a basal that's starting to erode the skin. A little bit harder to find. These are morphiiform basal cells that just look like scars. So if you go and your dermatologist asks you, well, how'd you get this scar? I mean, yes, we're curious, but we're also wondering, if you don't know, we're wondering, could this be a scar morphiiform basal cell? Squamous cells are a little bit different. They're the second most common. They are also pretty easily treated. They have more likely a tendency to become invasive. The interesting thing about working here is that organ transplant patients have 100 times more likely to get a squamous cell. So we do see a lot more squamous cells than the general population. So they're going to appear, they can look like basal cells, but they're going to appear more, I'd say, wart like painful growths on the skin. Horns is another word we use. The precursor to these are called actinic keratoses. 10 to 15 will become squamous cells. These are the ones you'll see that we treat with the liquid nitrogen. Here's some pictures of squamous cells. We have horns, we have some crusts. Putting a little bit more dramatic ones in there, but here's what it sort of looks like a basal cell. But again, any non-healing sore, anything that you're like, boy, when I wash my face, it bleeds, we need to know. And then the last but not least is the melanomas. Melanomas are the most serious form of skin cancer. They're dangerous because they're very sneaky and they have an ability to go to other organs. They like the brain, they like the lungs, they like to catch that ride to the lymph nodes. 20 to 30% are found in existing moles, but surprisingly, a large percentage are new appearing skin lesions. So if you tell me I'm 50 years old and I have a new mole, that's going to concern me. So this is one key thing I just want to review with you. The ABCs of melanoma. Asymmetry, which means if you fold that mole in half in your mind, if one side looks different than the other, we don't like that. Irregular border. I always say a starfish arm growing out, a satellite tail, anything on the border that's not regular. Color, grays, browns, whites mixed together, all together, or, forming a myriad of colors we don't like. And then diameter, and I always include E, which is evolving. So if you have a mole that was big at birth, it's probably going to stay at birth. But if you have one that the diameter is bigger than a pencil eraser, with time it has grown, we're concerned about that. Here's some examples of some recent melanomas. This is a pretty obvious one. Now for a trivia question to wake you up from that boring science stuff. Bob Marley, Jamaican singer, songwriter, and musician, passed away at the age of 37 from a metastatic melanoma. Where was the site of his primary melanoma? So there's a new Netflix movie about this, so people are talking about it. It was on his right first toe under the toenail. And the reason I bring this up is to show you this is not just a skin type 1 and 2 problem. Skin cancers can develop in any type of skin pigment type. These are acral melanomas under the toenail, on the heel. Acral melanomas are they're pretty dangerous. We all melanomas are, but we want you to keep an eye, look for new spots under your toenails or the bottoms of your feet, because we don't always look at the bottoms of our feet. As I said before, melanomas like to spread. There's a PET scan of one. Here's one with some mets in the heart. But all is not lost, because there are some real normal things that we can get as we move through time, I always say, that can look dark and scaly and crusty, but are completely benign. And these are called seborrheic keratosis. So if you've had a skin check and your doctor says some big long word, These seborrheic keratoses are fine and benign, and so it's our job to sort of differentiate between those. So let's talk for a minute about wrinkles and brown spots. What are the insults that cause wrinkles and brown spots? So scientifically, we have UV radiation coming in, we have cigarette smoking, we're hitting these collagen and elastin fibers, so we're causing breakdown of that. And I always talk about collagen and elastin as like a rubber band. Once it's broken, there are very few creams that can bring two ends under tension back together. So we want to protect our collagen and our elastin. Skin aging, 90%, we do kind of attribute to sunshine. 90% is kind of high, but we do contribute a lot of it to sun. Um, Studies have shown that people who wear SPF of just even SPF 15 are decreasing their chance of skin aging by 25%, 24%. And remember, I said sun damage is cumulative. So that means, well, I didn't wear sunscreen when I was younger. It's never too late because you're always protecting from that second hit or that next hit to your DNA that's going to kind of tip it over. Don't smoke. Smoking narrows the blood vessels. The outermost layers of your skin have decreased blood flow, depletes oxygen and nutrients to the outermost part of your skin. So we also know it damages elastin and collagen. That's what we talked about, giving your skin strength and elasticity. And interestingly enough, pursing your lips when inhaling can increase with wrinkles. I know there's a lot of stuff out there about drinking out of straws and stuff like that, but really the motion of constantly pursing those lips can increase and contribute to wrinkles. So we're going to review this again. This is a picture, a very famous picture that we have in our derm text. And this lady sat 15 years next to a window like the one that I am sitting next to. And this shows the UV force of photoaging. As we talked about it, UVA can penetrate glass. As you see on her right side, just like our delivery driver, pretty good. On the left, we have collagen breakdown, we have elastin breakdown, brown spotting, and wrinkling. Two women, same age, one that worked outdoors, one that did not, that worked indoors. So you can see the change of photoaging. And just a real quick thing about sunburn. Someone like nice little Irish girl like me has experienced plenty of sunburns in my life. Sunburn is actually, your cell receives so many hits of radiation that at some point your DNA is like, I'm done. It signals to the cell to commit suicide, and then the process is called apoptosis. So basically, if you come to the emergency room with sunburn, there's not much we can do except for pain control because those cells have actually all just died and committed suicide because of the damage. The more sunburns you have, you're doubling your risk of melanoma. I'm hoping that this next generation that is so educated about sunscreen is going to sort of put me out of business. That would be great. So then what can we do to return the lab? We can protect ourselves. And how do we exactly do that? So we're going to talk a little bit about sun protection. Zoe Dralis is one of our dermatologists nationally who's known for a lot of cosmetics. She said, what teeth would you brush? Only the ones you want to keep. Where would you use your sunscreen? She says, only where you want your skin to stay young and beautiful. So back to our science, we see that UV radiation is going in. We use sunscreen to sort of reflect it off to protect our DNA. I sort of tend to think of it as an umbrella that's sort of knocking those rays out, protecting our DNA. So the best method is sun avoidance. Seek shade between 10 and 2. Wear lightly colored, tightly woven protective clothing. They do have a rating on clothing now. It's called UPF rating. We like hats. We especially like wide brim hats. Baseball hats are good, but it does forget the ears and the alley behind the ears. We want you to avoid tanning beds, and we want sunscreens at least 15. And we do want you to put it on a daily basis. Little tip I teach my kids, the shadow rule. If your shadow is shorter than you are, the sun is at its strongest. If the shadow is longer than you are, then the sun is at its weakest. If you have no shadow, you are directly under the sun and you are in prime target for UV radiation. So someone asked me once, what is sun protection factor? So the SPF, what they do is they calculate the amount of time needed to produce a burn on unprotected skin, and then the amount of time needed to produce a burn on protected skin. So an SPF of 10 means that you would ordinarily burn in 10 minutes, but then you would burn in 100 minutes. But, sunscreen's not perfect. None of us apply it correctly, myself included. We tend not to reapply when we should. If you use a spray, I always say you do still have to rub. It even says no rub because you can get streaks of burn between your spray. And then when we sweat, swim, hot tub, we do smudge it off. Another question I get a lot is, what am I looking for in sunscreen? We want a broad spectrum sunscreen, um, providing UVA and UVB protection. And that has a little bit of history because the first ones they made only had UVB protection. So it was a burn protector, but it wasn't an agent protector. But now we talk about two things. Chemical filters, they actually absorb and convert the UV radiation. And these are all the chemical names you see. All the PAVAs and parabens have been removed pretty much from those. And then they're physical filters, which are getting a lot of good press lately because they are able to make them micronized so that you don't have a big white nose when you wear titanium and zinc. Those are going to be physical blockers. They actually scatter the UV radiation, and these are a little bit better for UVA, whereas the chemical ones were initially better for UVB. So you'll see a lot of them. People will say, well, which one should I use? I personally feel they're all safe. If you have any allergies, I do tell you to use the children's ones because they're fragrance free, because fragrance can be a real issue with some of the sunscreens. If you're a purist and you want it to just reflect off your skin, then go with the physical filters like titanium and zinc. How do you apply it? None of us do this right. We're supposed to apply it 20 minutes before we go out in the sun. 1 ounce is considered what you need to cover your body. That's going to be like a shot glass worth. And some authors say, hey, you should probably reapply 30 minutes after you go out to compensate for how improperly we did it when we initially put it on. We want to reapply 2 hours after getting wet, every 2 hours or after getting wet, sorry. Most common missed areas, ears, the lateral neck, and our temples. And don't forget our lips. We can get sunburns on our lips. A few other fun facts. I'm always asked, what if there's no sun? On cloudy days, 80% of the UV radiation passes through the clouds. And I know this from the spring football games that sometimes are cloudy and then we see a lot of sunburns after because people think, oh, I'm not going to get any sun because it's cloudy. It's spring. We're not thinking about sunshine, but 80% of those rays are hitting you. Sun reflects 17% off the sand, but 80% off snow. So skiing, it's really important if you're a winter sport lover that you're wearing sunscreen on that face. We can get sunburns when it's cold just because it's reflecting up. And then water penetration is interesting. So 60 centimeters down in the water is about the depth that you can still get UV radiation. So keeping your shoulders about a centimeter underwater isn't going to really help you not burn. Okay, some trivia. What wavelength of light is used to produce vitamin D in the skin? UVA, UVB, C, or visible light range. So this is important because it is going to be UVB. And this is taking you all back to your biochem classes about how the liver, the kidneys, the skin, everybody's involved in making vitamin D. So the controversy is, well, what about vitamin D? Like you dermatologists are telling me to wear sunscreen and now my vitamin D levels are low and that's increasing my colon cancer, all these things. So the Skin Cancer Foundation says, the responsible way and the most rational approach is really to have an adequate diet. If you don't supplement, either up to 1,000 units a day for adults or 200 international units for children. So that comes to our myth buster. You cannot get you cannot get adequate vitamin D from tanning beds. It's not an option. And the reason is because what we learned before, most tanning beds are delayed tan, so they're mostly UVA light. So you're not even getting UVB. Remember, A is the delayed tanner and B is the burner. Now, there are some tanning beds that are putting 1 bulb of UVB in there so that they can mark it and say, we're going to increase your vitamin D level. But the question is, can you get adequate levels? The answer is probably no. So tanning. Tanning has a very interesting, and this is beyond the scope of this lecture, but it has a very interesting social sort of consequence and when it started and when it wasn't. In the early times, like the Renaissance times, people carried parasols because they didn't want to get tan. And then there was a shift in about the 1920s, and I'm going to ask a trivia question. Which fashion icon made a tan a chic accessory in 1923 after getting too much sun on a Mediterranean cruise? The photographs of her disembarking in Cannes set a new precedent for beauty. So this poor person gets blamed for a lot of the shift of cultural significance to tan, but I think it was more early on, outdoor work was sort of, not for the wealthy. So the parasols and the people sat around inside, but then it became, we have time to vacation. We have all these chic accessories, we have all these cruise ships and stuff. So it became more of a social thing. And that answer to that is Coco Chanel. So what is a tan? So melanocytes are pigment producing cells that are sort of down there in the basal layer of our cell. They produce pigment called melanin, and that's what gives skin our color. People are born with different amounts, melanocytes have different abilities to produce pigment. And so what UV radiation does is it goes in there, it triggers damage, and it tells the melanocyte, hey, we need protection. So like I talked about before, putting an umbrella above your DNA, you're using these melanin, this pigment, to attempt to protect your skin by creating kind of a blocker or umbrella there. Melanoma occurs when there's too much sort of stimulation in the melanocytes, like we talked about, too many mutations, and then we get a clone, and that's that uncontrolled cellular growth. So tanning beds, as we talked about, emit harmful, mostly UVA, so you get that delayed tan. This radiation can cause cancer. It does increase your risk for melanoma, squamous cell, and basal cell carcinomas. So people ask me, what do you think when you think of tanning beds? And I say, well, there's all different types, but mostly when I think of a tanning bed, this is sort of the view I get in my head. So I do have a teenage daughter who says, well, what if I want the golden glow? I want to have these, this wonderful tan-like color for social norms. And so we talk about sunless tanning, and that is safe. Sunless tanning is just a stain that works with mineral proteins on the skin to basically stain or lock in a color on the skin. So this is DHA, and it is safe. I have looked at many studies. There is nothing that is dangerous about it, and it's a lot better than when I was growing up. You don't have the orange palms. There's a lot of slow, gradual pigment that they're doing with it. Concentrations range from 2.5 to 10%. The lower concentrations are the lighter shades, and the higher concentrations are the darker shades. So I get asked a lot, what about my base tan for vacation? And I always respond, or tanning for prom. I get asked that a lot. And my answer is, first of all, I know who you're talking to. Um, and then I say, there's really no safe way to suntan. As we talked about before, the skin is actually producing melanin as a response to injury. And then the melanin production from a tan really is only an SPF of 3. It's not even that great of a tan. So pre-tanning leads to more decreased use of sun protective caution. It's also used to added pre-vacation radiation. So, if you want to talk about base tans, I wouldn't talk to your dermatologist. Another fun trivia to lighten up the mood here. Okay, so you're in the forest and for some reason you need to wipe your skin I'm not going to discuss why. We have to wipe our skin. Which of these leaves would you use? You're reaching down. Would you use this one or this one? This is just a life hack. The reason I'm going to teach you is don't use the leaves of 3. Leave them be, because that's poison ivy. And you will not be happy when your skin rashes from that. All right. So how can we return the love? Number 2, cleansers. So we recommend gentle washing. Be careful not to strip or irritate your face. It's a myth that acne is a hygiene issue. I grew up in the generation where we were told to scrub your face, sea breeze, alcohol, all these things. But now we know there is a lot of value to your natural oils. We want to use a gentle wash. It's a myth that your pores operate like doors. Steaming hot water does not open these pores and dump out its contents. Cold water doesn't shut them out to keep dirt out. That's not really a thing. Pores are a little bit more complicated than that. And when we worry about all these trends online of steaming and hot waters, hot water extremes can cause irritation of your skin. And if you have any bit of rosacea, which a lot of people have, this can cause a flare if you use too hot of water. Now we're going to talk a little bit about moisturizing and creams. So here is your skin, and here's dry skin, and you can see as those squamous cells kind of break apart, you're going to get irritation, you're going to get itching. Itching is a big thing, especially in Ohio. Our humidity drops once your heat turns on. I don't care what type of heat you have, whether you have gas or electric or wood burning. when heat kicks on in the winter, the humidity drops, so our skin gets very dry. Creams are going to be more moisturizing from lotions. And if you've seen me as a patient, I always do this demo that creams you scoop or squeeze, lotions you pump. They're both good, but sometimes in the winter, I have you move from the pumps to the scoop and squeeze. And then the best time to moisturize is right when you're out of the shower, when you're so sort of wet, you want to pat dry so you're not soaking, but you're still warm and moist, and the skin will kind of be receptive to taking that moisturizer in. And then last but not least, retinols and antioxidants we're going to repair. So, my teenage daughter says I'm not a real dermatologist because I don't have a TikTok channel. But what I tell her is I am limited by this little thing called a medical license and empiric evidence and data. So, what I'm going to talk to you about are the things that are proven and have scientific data behind them. And one of them is retinols. So, retinols are vitamin A. They are antioxidants. They do stimulate cell growth. They build collagen and they build some elastic repair. So, retinols have 3 levels. The bottom level is going to be over-the-counter retinols. That's going to be your Regeneris, your stuff over the counter. Then you're going to have one that's a step up that was prescription until 2020, and that's called adapalene, and that used to be a prescription tretinoin or Retin-A or retinol. And that's going to be different brands. Now that it's off patent, there's going to be a lot of different brands that you're able to do. And then there's tretinoin. And that's going to be what people call your Retin-A, your prescription Retin-A. For all 3 of these, you have to be really careful not putting too much on because these are all very drying and it can make your face tight and peel. So we recommend pea size, 1 pea for your entire face. You're going to dot into the 4 quadrants of your face, rub that in, and then use your moisturizer that we just talked about right on top. So also, when you get radiation, you're going to create free radicals, and free radicals are unpaired electron. As the radiation hits these cells, you're going to get this outer layer unpaired electron, and that can do a lot of damage. It does a lot of damage to your collagen, your elastin, and other cells. So the idea behind antioxidants is that these antioxidants are going to come and they're going to pair up with these electrons. They're therefore decreasing your oxidative damage. So there is evidence, like I said, we're going to talk about evidence-proven things about using topical antioxidants like vitamin C and vitamin E that can kind of protect us against oxidative damage. The argument is, if I'm wearing enough sunscreen, then do I need an antioxidant? And the answer is probably no. I'm not smoking, I'm wearing my sunscreen, probably no, but as far as things go, there is evidence behind that. Here's a trivia question. If you've heard of all of this trend of these kids going into Sephora and Ulta and all these places spending over $1,000, the trivia question is, what age group is this trend most likely seen in? Is it 10 to 12-year-olds, 15 to 18-year-olds, 21 to 25-year-olds? And you'd look at this and you'd think, well, who's on TikTok? Who's on all these things? Probably 15 to 18. But the shocking part about these trends is that it's 10 to 12-year-olds. So young kids, Generation Alpha, which I didn't even know was really a thing, I think 10 years old, are flocking to these beauty retailers. They're buying these viral skincare products, and they're being really influenced by social media again. And Elise, who said that the irony is that products glorifying youth are being sold to actual youth. So what are my suggestions to you? I'm overwhelmed walking into these stores. So if you're overwhelmed, if I'm overwhelmed, you're probably overwhelmed too. So we say, stick with the science, stick with the basics, and simplify your skincare routine. We definitely want a gentle cleanser. We want sunscreen, and I suggest wearing it every day. Put it in your moisturizer. It's a lot easier than it was 20 years ago. We used to have to tell people put moisturizer and sunscreen, but now they're kind of 2-in-1, so that's nice. And then at night, you want a gentle cleanse again. You want to moisturize, and then the science is behind the retinol, adapalene, or tretinoin. One of them, not all 3 of them. And then if you want to add something else, antioxidation with these vitamin C's, vitamin C, it has science behind it. Product differentiation, I don't know, but there is some science behind that. And then moisturizer wise, I get a lot of questions about hyaluronic acid, snail mucin. All those are good moisturizers. I don't know what long-term effects I can tell you about, but I'm not opposed to that. Just find a moisturizer you like. And if you're really sensitive, like I said, stay away from the highly fragranced things because fragrance is a real problem at times. And then I'm just going to send a shout out for skin checks, self checks. Use your ABCDs. You know, my chart's really great. You can send me a picture if it's not blurry or foggy. And then you can learn how to do a thorough self exam through the American Academy of Dermatology. And there's their website there. So this was a song you guys are probably all too young to know. It was written by, it was in the Chicago Tribune. They made it to like a talking song. And at the end, they said, ladies and gentlemen, wear sunscreen. If I could offer you one tip for the future, it would be, that would be it. So actually, I'm finished a tad bit early. So I'm going to stop sharing screen and I can answer some questions.
Thank you so much. That was such a great, informative, educational presentation. I loved all the trivia questions. I thought those were a fun little add-in. I saw some people in the chat participating. So that was fun. And especially all of the like sun protection, very timely since we're in summer. I think this weekend it's supposed to be very hot and sunny. So very timely. Sunny right now, it looks like at least. So yes, go ahead. We have plenty of time for questions. So put any questions that you have in the chat. I see some coming through. Hold on, my chat keeps moving. Let me pull it up. Sorry. Okay, so the first question that came in was asking, what are your thoughts on the
The
melatonin?
melatonin spray.
Oh, melatonin nasal spray that increases your melatonin.
Okay.
We also have an
So
injection form.
you know, these are not FDA regulated, so I would probably say I don't think they're great. And there have been cases, if you've looked at people using sort of compounded ones from non standardized things. So I don't love it.
Next question. I get deep skin cracks around my fingertips and heels in the winter, and they bleed sometimes. How do you treat and prevent?
Okay, so this is the problem with everyone, especially during COVID. We're washing our hands a lot. So what we say is sort of a little bit. So we want to make sure when we can, we wash with soap and water as opposed to the liquid, waterless gels. Now, I know working here at Ohio State, that's almost impossible. We have foams and gels, but when you can, soap and water. And when you do wash your hands with soap and water, we want to dry them completely. Evaporative loss when we shake our hands can dry the skin out more. And then moisturizing almost every time we do it. Every time we wash our hands, we're supposed to moisturize. I know it's impossible. It's impossible for me. I probably counted once. I wash my hands about like 78 times a day. But also, if it gets bad enough, what we do is we want to pre-treat with like a topical steroid at bedtime, sometimes on our cotton gloves. The heels, you can also use a urea cream that you get off Amazon or an amlactin cream that you can sort of take some of that scaling down because once it cracks, it's like a valley, a fissure. It's really hard to heal.
Thank
And
you.
then the next question, I'll just read it so you don't have to. What are our thoughts on red light for anti-aging, renewing skin on the face and neck? So again, a little bit of questionable data on this. Someone asked me this the other day. I don't think you're harming yourself because it is visible light. You're not getting UV radiation. I just don't know. I'm going to be fair with you. I don't have on the tip of my fingers like exactly what the data is on the numbers on that. I don't think it's harmful, but I don't know. I can't give you good numbers about how well it's working. What is the likelihood of getting skin cancer if you're not wearing an SPF lip balm? This is fascinating because the most common areas I see the most common people I see with lip squamous cell skin cancers are marathon runners and people who spend a good bit of time outdoors who have been really cognizant of wearing sunscreen, but I think we just kind of missed the SPF lip balm. So my suggestion to you is if you are like outdoors for a good amount of time, I would wear like lip balm that has SPF in it because those are kind of the people that I have seen the most likely. What are some there are creams with probiotics and prebiotics in them. What would that do for your skin? I'm actually not sure because I don't know how it affects your skin biome. I'm going to be fair with you. I'm humble enough to say I don't know a lot about probiotics for the skin. IPL for the help rosacea, that's a great idea. You know, IPL is usually a cosmetic cost, so people don't love that, but it should help and work with that. Again, with rosacea though, your biggest trigger. Everybody is triggered with rosacea from sun, so we want to look for sunscreen as our #1 treatment for rosacea. Will not wearing on my neck cause wrinkles? Yes. Does it increase the aging process around your neck? Yes. And that has a big fancy French name. It's called poikiloderma of Savant. And you can see the sun damage that is spared by the shadow of your chin. So you'll see nice fresh skin here, and you'll see this red little vessels and brown all around the neck. So yes, I always tell everyone who comes to see me, don't forget our neck and our chest. Our chest is what gives us away. We're really good about our skin on our face nowadays, but we're not great about our chest. And think about all the ambient radiation that's sort of hitting our chest. Okay, next question. Sorry, I'm not reading them. I'm sorry. Skin cancer runs on my maternal side, 3 of 7 with melanoma, including nose reconstruction. Oh, and other 4 different cancers outside preventive measures already. Is there anything else you can do? So the one thing there is some evidence to is taking niacinamide or B3 vitamin that has been shown to decrease some squamous cells and basal cells. So that's a supplement that we're kind of looking into to giving people with multiple things. But really with a melanoma history like that, really what's going to be important is surveillance, making sure you get into your dermatologist, making sure they know your family history, and making sure that you're doing your own skin checks. So the next question is dry brushing and gentle brush actually beneficial to your skincare routine? So probably you're just exfoliating. I don't think it makes you feel great. And that's sort of like people who use a lot of toner, they like the feel of it, but I don't know that it's actually cellularly doing anything for you, but I don't think it's going to hurt you. Are we better off not being in the sun? Totally. I mean, you're asking a dermatologist. Well, yes, I think if we could prevent but we don't want you to be a hermit. I tell my patients all the time, I don't want you to be a hermit. Just be responsible, wear your sunscreen, and try not to get sunburns. And don't let the next generation get as many sunburns as we got. Through the years, I spent 10 to 15 minutes in natural vitamin D. So that Yes. So that study is when they did that study, they said 10 to 15 minutes on the backs of your hands every day was enough to provide natural vitamin D. Some people have disputed that. And, you know, the hard line of the cancer institution is we'd rather have you get your vitamin D through diet and supplement. So you are correct. That is the one thing. Does fascia blasting really help with cellulite? Oh boy. So that fascial blasting is getting a little bit beyond what I do as a general dermatologist. But you can ask Dr. Ship, who is our cosmetic dermatologist, who is going to be doing some cosmetic procedures to do with cellulite. And is there I'm sorry, is there some risk even if you walk in the shade during the day? Well, no, like I said, I don't want you to be a hermit. You can walk in the shade, just be more responsible, trying to wear your sunscreen if you're going to be out. If you're in the shade, yes, I want you to go outside. I don't want this to be a COVID situation where we're trapped inside, but just be responsible. Okay, so this is actually a really great question. The next question is about psoriasis. And ironically, we treat many different skin conditions like psoriasis and atopic dermatitis, itching, and that with narrow band UVB. So we sort of limit the amount of radiation, but we do know that sun can decrease, 311 or 308 can decrease this inflammation in our skin. So yes, we will use light sometimes, and that is going to be a risk benefit, right? Is it better to get a little bit of one wavelength of light or take a biologic medication? We have to sort of, benefit that. But there was something called PUVA that we used to do a lot more, which is UVA with Sorlin sensitization. And the downside of that is, well, I always tell people today's cure is tomorrow's curse sometimes, right? So all these people that got PUVA are getting some squamous cell skin cancer. So you're right on that. Um, um, I think with most of the other types of radiation, you're kind of going right through the skin. So you're going to get you're more likely to have other types of cancer. I think skin cancer is sort of related to that wavelength where it stops as it goes through. But I'm not sure, and I don't want to say medically, whether that's true. So I think that is most of them.
Yes, that was a great rapid fire Q&A right there. So thank you everyone for those questions while I'm still talking. If you have another one, you can put it in. I am going to put in the chat a link to a little eval. If you've done these before, you're very familiar with them. We want to hear what you thought. We want to hear, what do you want to see? What topics do you want to have coming up in future months for this? So let me put that in there real quick.
All right, I do want to address the last question we got. Gel manicures. Yes, it is cured with UV light. So what our party line is right now is we want you to take a little, and if you don't have one, we can give you one, a sample of sunscreen to your nail appointment. And we do want you to put sunscreen on the backs of your hands when you get your nails cured. So that is sort of a way we can kind of come across that. And then dermaplaning. Dermaplaning, again, is more of a cosmetic procedure. That is more for cosmetic outcomes. Not a lot of data that anything is happening under the skin. And I do apologize if I talk fast. It's just a bad habit I have.
No, this was absolutely wonderful. I actually myself have a question from something you talked about way at the beginning about different clothes having sun ratings on it. I have not heard of that. And could you just talk a little bit more about
Sure.
that?
So now they're rating clothes as UPF, and basically that UPF means how tight the weave is. Okay, so I'm sure you've heard of rash guards, which are like swim shirts. So they're UPF rated highly. So basically all you're reading in that is tight weave. Okay. So you don't actually, if you have a shirt that is tight weave, you're probably fine. You don't need to get the actual UPF rating. But if you're concerned or you have a history of melanoma, you want to go for the highly UPF rated. Okay. So examples like with hats, like some people are like, oh, I wear this weaved wicker hat, but when you look at it, there are spaces all between there. So that's not great. You want something that's tightly weaved. Okay.
Interesting. Thank you for that. Okay, I don't see anything else in the chat, so I'll start closing it out. Thank you, first of all, Dr. Malerich. This was wonderful, so informative, just so helpful. So thank you so much for your time, your expertise. I know I appreciate it. We all appreciate it. So thank you so much. Thank you to everybody else who tuned in and joined us and had questions, participating in the chat. Makes it wonderful. So thank you so much. I put the link to the eval in there. If you could please take it, I will repost it just so it's in there. Let us know what you want, what you thought. Thank you so much. Everybody have a great Friday and a wonderful weekend.